Good days everyone. On today's video I'm gonna talk about the ophthalmology. This is the table of the content. So first of all, let's start with the basic anatomy of the eye and its function. As you can see in here, we have the cornea. The cornea located at the very front of our eyes. Its function is to protect the intraocular structure from any foreign substances. It also contributes to refract the light that will focus into the retina. Second, we have the retina. The retina consists of photoreceptor layer. This layer is to convert the light into the electrical signals. These signals which then transmit into the brain and give us the visual perception. Other than that, we have the vitreous, which is the largest thing you can see in the anatomy of the eye, right? So basically its function is to maintain our eye shape, okay? And it also acts as shock absorber. How? When someone punch into our eyes, the vitreous humor will distribute the force and reduce the impact, which will reduce the risk of our eye getting damaged. Moreover, we have the iris, which is the colored part of our eyes. It forms pupil at the center, which enables the eye to control the amount of light entering it. How? When our eyes exposed to the light, the pupil will constrict. When we in the dark place, our pupil will dilate to allow more light enters into our eyes. Moreover, we have lens. The lens is clear, flexible, and avascular. Its function is to refract the light that will focus into the retina. Lastly, we have the ciliary muscle, which will change the shape of the lens. How? When it contracts, the suspensory ligament that attach to the lens will be stacked and change the shape of the lens into the rounded shape. When the ciliary muscle relax, the suspensory ligament will pull the lens and it will become flattened. Let's move on to the next slide. On this slide, I'm going to talk about the accommodation, emmetropia, and ametropia. Accommodation is the ability of the eyes to focus on the object at any distance, especially when you want to see the object that comes towards us. There are three processes. First of all, the converging of the eye, where our eye will track the object that comes towards us and keeps the image at the center of the fovea. If the converging of the eye does not occur, we will see the double image of the object that comes towards us. The second process is the pupillary constriction. In this case, it allows the light to be refracted and focused on the center of the fovea due to the diverging rays cannot be bent enough by the lens itself. The third one is rounding up of the lens. In this case, our lens will change its shape to be rounded shape that increase its refractive power so that you can focus the light into the center of the fovea. Now, let's talk about the condition of the eye. The normal condition of the eye without no refractive error, known as emmetropia. So, emmetropia is when the lights from afar that enters into our eyes will focus on the retina and produce a clear image. Ametropia is the condition of the eye where it has refractive error. There are three types of ametropia, which is myopia, hyperopia, and astigmatism. Let's start with myopia. Myopia is the medical term used for short-sightedness. In this case, when the light enters the eye, the focal point of the eye lies at the front of the retina. This will cause the diverging rays that falling on the retina will produce the blurred image. The cause of this is due to the eyeball being too long. This will displace the retina slightly at the back from its original position, and the other reason is because the cornea having too much curvature. This is the example of image that seen by myopia patients. The second one is hyperopia. Hyperopia is the medical term used for long-sightedness due to the eyeball shape is being too short, which displays the retina slightly at the front from its original places, and the other reason is because the cornea have too little curvature. In this case, the focal point of the light lies at the back of the retina, which cause the converging rays that fall at the retina will produce a blurred image. This is the example of the image that what people with hyperopia will see. The third one is astigmatism. Astigmatism occurs due to the focal point is more than one. The main reason of this is because the corneal shape is shaped like a football or oval shape. This is the image of what people with astigmatism will see. In this slide, I'm gonna tell you about how do we determine the refractive error. In general, all we have to do is go to the eye clinic and get medical checkup and eyeglasses prescription. But have you ever wondered what is this machine? Yes, this is an autorefractor, which is automated computerized instrument that determine the degree of refraction. The procedure of using this machine is very simple. First of all, use the forehead and chin adjustment to align the patient's eyes with the instrument. Second, we instruct the patient to focus on the target. The target usually in form of light or an image within the autorefractometer. This helps the patient to maintain a fixed gaze during the measurement. And then, we activate the autorefractometer to start the measurement process. This device uses infrared light or other technology to analyze how the light enters and exits the eye, and providing objective data on the refractive error. And then, the autorefractor will automatically generate the result which show this kind of prescription. As you can see in here, we have OD and OS, which basically indicate right and left eye respectively. The first column is a sphere, which will determine the degree of refraction error. If it is negative, the patient has myopia, and if the value is positive, the patient has hyperopia or long-sightedness. The second column and the third column indicates either the patient have astigmatism or not. The axis will determine the strength to correct the astigmatism, and the axis column, will indicate the angle of the astigmatism. The last column is add, which means addition for bifocal lens. Its function is just to indicate for reading lens purposes only. Other than autorefractor, you also can see this chart on the eye clinic. This chart is known as Snellen chart, which measures visual acuity. In this Snellen chart, you can see different sizes of different words. From big, it will getting smaller and smaller as we go down the chart. Here, you can see the fractional notation. The numerator indicates the testing distance, and the denominator indicates the distance at which a person with normal vision can read the same line. For example, if the patient can read at 20/20 lines, it means that a person can read at 20 feet what a normal vision can read. If someone got 20/40 vision, it means that they can see at 20 feet what a normal vision person can see at 40 feet distance. So, how can we determine the perfect eyeglasses if we have refractive error? We can use a trial frame. In this case, doctor will insert different lenses in front of patient's eyes, and by switching the lenses and asking the patient to compare the clarity of vision, we can determine the most suitable prescription to correct refractive errors. We also can use the Snellen chart during switching the lenses of the trial frame until the patient can see the 20/20 line. During an eye exam, the person covers one eye and reads the letters aloud from the top row down until they can no longer discern the letters accurately. But as long as the patient can read the 20/20 line, it is perfect visual for them. The same is then done for the other eye.